and welcome. We're glad to have those of you who are directly on the call with us this morning, as well as those listening via the town of Bluffton and town of Hilton Head Islands social media, and also this morning as well on the Beaufort County channel. We're certainly glad to be back on the Beaufort County channel again today. The Chamber's teletown halls continue to convene, convey, and connect the Lowcountry. We're pleased to be your resource for unfiltered information and the latest news on how we're facing the pandemic challenge together. And there's no doubt we're a community and a country at a COVID crossroads. Senator Lindsey Graham will be speaking later on our call on whether we can expect additional round of direct payments to households with the $1 trillion plan on the table in the Senate, along with the possible payroll tax cut. And we're also anxious to hear the latest on school reopening plans and ask questions to Dr. Frank Rodriguez, our superintendent, with one of the most challenging jobs in the Lowcountry as he leads the district in the next month of planning. If there's anything this pandemic is showing us, it's the incredible importance of small business to our economy. Our first speaker this morning is hard at work every day for all of our businesses. In his role as the Vice President of Small Business Policy, Tom Sullivan translates the grassroots power of small business into federal policies that bolster free enterprise. You might ask, what have Tom and his team done lately for small business? Well, several things. Just to name a few, they're working on protection against unwarranted lawsuits related to COVID-19. They're supporting small and mid-sized employers by calling for an extension of PPP and expansion of the employee retention tax credit. They're also working on financial assistance for childcare in K-12 schools as we reopen. They're supporting sensible unemployment benefits and funding for job training. They're working on assistance for state and local governments experiencing sharp reductions in revenue and their increasing costs of COVID compliance. And that's only to name a few. So we're delighted once again to welcome back our friend for the U.S. Chamber of Commerce, Tom Sullivan. Tom, welcome back.
Bill, thank you. You covered everything I wanted to make sure to share with your group. So thank you. If I sound like an echo chamber, that is just because I'm echoing the leadership that you provide, and you're as up to date as I am. I'm excited that this week the House and the Senate are negotiating in earnest to get more help to small businesses, and the U.S. Chamber, in conjunction with you and over 1,600 of your closest friends who run chambers of commerce around the country, really put together the top priorities needed for the chamber. Your humble bill, to leave out one part of kind of the stimulus that we continue to insist on, and that is that when we're looking at the need for small businesses to access loans and grants to help survive the pandemic, unfortunately, Congress has left out you. They have left out local chambers of commerce, who I have heard act as the economic emergency rooms for small business communities all over the country. Unfortunately, nonprofits that are organized as what are called 501c6, that's a reference to a particular provision in the tax code, they are not able to access SBA disaster loans and PPP loans. And we've gotten almost unanimous agreement from Congress, and we're certainly going to be joined by one of the leaders, Senator Lindsey Graham, in a few minutes. Everyone has agreed that local chambers of commerce should be part of the communities that receive financial help from the federal government. So that would be the only addition to those priorities that you outlined that we're excited about and we're working with Congress to implement. I'll highlight again really the top three priorities that we're pushing for. First of all, additional financial assistance to the small businesses and local chambers that need it most. And that means that an extension of PPP, but targeted specifically for businesses that have experienced significant revenue loss, or businesses and nonprofits like local chambers of commerce who have not been able to access PPP loans. Now, That would be for second PPP loans, or in the case of local chambers of commerce, the first time that they have access to this program. I hear all the time, what about the loans we already have? It seems like there's a lot of calculations that go into getting those loans converted into a grant after the 24 weeks that are allowed to use the loan proceeds. We've received tremendous support in Congress and the Senate in particular, and then we're going to have a legislation introduced tomorrow in the House by, I believe, Congressman Fred Upton from Michigan, and that legislation calls for automatic forgiveness for small business PPP borrowers who borrowed less than $150,000. And the concept is, why should we bog down small businesses with all the type of paperwork to get their loan converted into a grant when that is the whole idea of this program in the first place? And Secretary Mnuchin testified before the House Small Business Committee last week that he is open to that idea. So we've got an increasing number of business groups supporting that initiative. Stay tuned as soon as tomorrow for the House introduction of that bill. And I think every time this kind of comes up on people's radar, everyone seems to nod their head in agreement. Well, that kind of makes sense. If it's intended to be a grant, trust the small businesses and turn it into a grant. Let the small businesses focus on reopening, rebuilding, and revitalizing their communities instead of getting bogged down in red tape that it would take to otherwise submit a forgiveness application to the bank. The bank then submits it to SBA, and the small business owner turns that money into a grant. So additional financial funding, adding liquidity in a simple way to small businesses, top priority. Also, liability relief. Bill, everyone in America, everyone, quite frankly, around the world is desperate for certainty. We wake up in the morning and we're not sure what the day is going to hold. We certainly don't know what the next week is going to hold when it comes to the coronavirus. So there is this need for certainty. I see that need for certainty magnified by the small business community. And our call for liability protection really focuses on the need for certainty. A small business owner does everything that it can do to protect its employees, protect its customers, consistent with local health advice and the CDC. The US government has to provide certainty that those steps will protect them from lawsuits going forward. And so those are our top three priorities, and we are just blessed to join with you and so many other local chambers of commerce around the United States to push for a pro-growth agenda so that small businesses can not only come out of the pandemic, but come out strong, get our economy back on track.
Tom, thank you. And we thank you also for mentioning the 501c6s and how important that is, and the work that you and the U.S. Chamber of Commerce are doing on behalf of that. Our first question comes to us this morning from Mel, Tom, for you. And Mel is asking, what industries remain hardest hit by COVID and are in the most need of another round of stimulus?
Well, that's a great question. We find that any restaurant that has the most direct interaction with consumers are the hardest hit. I mean, primarily it's restaurants and the hospitality industry. Those you can't serve food just exclusively over the internet or remotely. So because there is that required person-to-person contact, they're the ones who are shut down the most and fear additional shutdowns in the future, and B, have to go to the most costly measures in order to protect their employees and their customers. So those two things combined equate to the hardest hit and the most financial help they need to recover.
All right, thank you. The next question comes from Ray. And Ray's asking this morning, the immigrant workforce has been reduced greatly by both COVID travel restrictions and government policies. Do you anticipate any changes to allow for visa workers to enter?
Well, the U.S. Chamber of Commerce joined with the National Association of Manufacturers and actually framed that question in an argument before the court out on the West Coast, trying to we have not been successful in convincing the administration to loosen some of the restrictions on a immigrant workforce. And so now, unfortunately, we've got to go to court to try to get them to loosen the restrictions. So we're optimistic, but unfortunately, it has resulted in having to file court action as recently as yesterday to try to encourage a loosening so that when our country gets completely back to work, we have the workforce that is necessary to rebuild our economy.
Thank you. And then Maggie is asking, you've touched on the liability protections a little bit earlier. Maggie's asking just for a little bit more about how the U.S. Chamber is working on behalf of small business and all businesses, really, in regards to that.
Well, our greatest strength is advocacy, and in Washington, D.C., we call that lobbying. We actually completely shifted gears from lobbying to education about 4.5 months ago. And so we took all of our strength that had previously been directed to Congress and the administration, and we turned them inwards to try to put out guides and information helpful to local chambers and small businesses on how to access federal help. I like to think that the dozens of guides in English and Spanish that we've provided to small businesses are kind of the government closed captioning. So government puts out all these rules, regulations, and access to federal help. And then we've tried to translate those into things that I would understand. They're less legal, more common sense, so that small businesses have access to these programs. I mean, Bill, you have worked so closely with us at the U.S. Chamber of Commerce, and we're both driven really by a very simple principle. And that is that no small business should close simply because they didn't know a program was there to try to help them. And so we have converted a massive amount of IRS, Department of Labor, SBA, Treasury, CDC information into usable information for small businesses. All that information not only available on your website, Bill, but also uschamber.com/CO. Again, that's uschamber.com/CO. That's our small business digital platform, and it is intended to get digestible and usable information into the hands of small business owners who need help.
Tom, thank you. Also, I just have a comment here that just came in, and that's coming in from Steve this morning. And Steve's just saying thank you and the U.S. Chamber for what you're doing, and especially with the liability protection and liability relief.
Well, Steve, thank you for tuning in. And most importantly, thank you for telling 5 of your closest friends about some of the information that you've either already learned or learning today.
Tom, thank you. We're gonna let you go. Hopefully, you'll stay on the line, be able to stick around and hear our other speakers this morning. But it's always refreshing having you on, and thanks for the great work that you and the U.S. Chamber of Commerce do. And one other thing I want to mention to our listeners this morning is members of the Hilton Head Island-Bluffton Chamber, small businesses who are members of the Hilton Head Island-Bluffton Chamber of Commerce through our organization are also members of the U.S. Chamber, eligible for that. And that's a terrific benefit, not only from the Hilton Head Bluffton Chamber, but from the U.S. Chamber as well. So, Tom, thanks again. Great to see you. Anything else you want to comment on that?
Only how much of an honor it is to advocate for those small business members of yours who are members of ours. It's just an incredible honor, and I hope that we're providing some value and help.
Thank you, Tom. We hope to have you on again soon.
Thank you.
You're welcome. Next, we're going to another very, very important subject, and that last week with the press conference and the discussion of schools reopening, we're fortunate to have our superintendent of schools with us, Dr. Frank Rodriguez, and also this morning he has with him his deputy superintendent, Duke Bradley. Dr. Rodriguez, we know it's an extremely busy and important time for you in the school district. Welcome, and thank you for joining us this morning.
Thank you, Bill. It's a pleasure to be here with you and to join you today. And thank you for the invite. Good morning to all on the call. as you can imagine, that since I last spoke with the group, we've been quite busy over here at the district trying to sort out reopening plans and opportunities for our schools and for our children and certainly our families. And it's been I liken it to trying to land an airplane on an aircraft carrier that's zigzagging in the ocean at night without lights. I mean, I've never done it, but I could just imagine that's quite a difficult task. So it sort of feels that way because information, recommendations, all of those sorts of things change not only on a weekly basis, but sometimes on a daily basis. And it impacts certainly decisions and plans that we try to roll out. So through that, we have been hard at work. I developed and put together a central task force here at the school district composed of district personnel from different divisions so that we could have cross-functional teams and think of things in unison as we move through it and not work in silos as we approach a problem as difficult as this. And so central task force began to work and look at some of the essential protocols that we might need to have in place at schools as we think about reopening. We then put together a comprehensive reopening task force that included not only the central task force, but also principals, representatives from each division. So we had several principals from elementary, middle, high school that participated in that group to try to think through some potential reopening instructional models that we might be able to use within schools. I went on and met with district teachers several times through our teacher forum to make sure that we were capturing teachers' voices and concerns through it. I also met with parents through a school improvement council Zoom sessions that we held in order to get parents and families' perspectives. We had gone out and early on provided some surveys that we utilized. So one was a thought exchange survey. That thought exchange survey allowed parents and employees to put information in terms of what their thoughts were that were most critical in thinking about reopening plans, what was most important to them. And not only could they provide their thoughts, but they also had the opportunity to rate each other's thoughts. And so we ended up with in the parent version of the thought exchange over 117,000 ratings on different thoughts. So we had approximately 5,000 families who are parents who had participated in that, who provided thoughts, but then they rated each other's thoughts, and it ended up with over about 117,000 ratings of each other's thoughts, sort of a crowdsourcing kind of platform. We did the same thing with teachers. And essentially what we found through that thought exchange survey at that time, that parents were approximately 50-50 split on whether we should have virtual only or whether we should have face-to-face. And then what emerged, not only from parents, but from teachers, was that there was a heavy emphasis on safety first. And there was a heavy emphasis on making sure that we prioritize that as we work through developing instructional models. And so we used that information and we put together some more traditional surveys that provided the opportunity for people to weigh in on things such as specific instructional models, like either a hybrid approach or a face-to-face, a 5-day face-to-face approach, or a half day each day, so that we could provide some of those recommendations, such as physical distancing, as a possibility. As you can imagine, schools were built and designed without pandemics in mind, such as this that we're going through, right? And schools are funded in terms of being able to fund personnel and hire personnel in a manner that is not conducive to pandemics. So we're trying to work through all of those components that we're dealing with. I think it's important to note that as we continued to move through that process, and I continued to engage our stakeholders, we have about 366 employees who are 55 or older, about 175 employees who could retire today due to their age or their years of service. 46% of our school district employees are either in the high-risk group or live with someone in that high-risk group, or are primary caregivers for someone in that high-risk group. I say that only to say that we are, like many of you, in a people business, and understanding the dynamics about your employee and your workforce, as well as understanding the needs of students and the instructional models that we have, all have to come together to make this fit. I should say my number one priority is the safety of our students, staff, and their families as we have moved through this process. As you're aware, the research on COVID-19 continues to change, and recommendations continue to change. My understanding is CDC and I believe the White House Task Force will be potentially issuing new recommendations on Friday as well, or new guidelines and recommendations, which then end up causing us to go back, review, and continue to change and modify the plans that we have laid out. Every school district in the country is dealing with it. We're not unique to that, and we're having the same conversations. I meet with several superintendents across the state, and we have conversations about how we're progressing and how they are progressing. We are all really along the same lines in terms of what's going on. So it helps to sort of share thoughts and ideas and best practices with one another as we move through this. We keep a very close eye on the DHEC metrics. And so we monitor that closely. For the past 4 weeks, certainly we've been categorized as high on all 3 categories that DHEC puts out for certainly for schools to use. The 2-week incident rate, the trended incident rate, and the 2-week percent positive rate that are metrics that we're encouraged to use as we look at and think about reopening. Because we're all dealing with these unprecedented times, we've developed a plan for reopening that is flexible and that can be adjusted as circumstances require. We have the plan that's laid out in the district website, but just a brief highlight of it. It is virtual option for parents that want to choose virtual for their child, and then in addition to that, there is a face-to-face option that is heavily governed by the amount of parents or families choosing face-to-face. The more in a school that choose face-to-face, the more difficult it is to adhere to recommendations from DHEC and from CDC regarding social distancing or physical distancing requirements, and so or recommendations. And so that can lend itself to a hybrid model where students would come to school, for example, Monday, Tuesday, and then Wednesday would be a deep cleaning, and then another cohort of students would come on Thursday and Friday, and so our classes would be subdivided that way. And then when they're not in school, it would be face-to-face. We have masks for employees and students requirements on there, or face shields that we have as well. And then so there's a face-to-face option and there's a virtual option. And then the other piece is that really if conditions don't improve, it is possible that we would open with 100% virtual. As you can see, some of our neighboring counties have already made that decision, which is, for example, Jasper, Chatham County to the south of us, Georgia. And there are other school districts in the state of South Carolina that are already either there or headed in that direction. So we're hoping that our metrics improve. That would allow the opportunity for us to have that face-to-face piece, but that possibility of everybody opening online is still very real for us. So at the moment, when I look at registrations from parents, we have over 10,000 registrations to date that are in. So that's more than just about more than half of our enrollment, or right around half of our enrollment. And at the moment, what that seems to be looking like is close to it's about 45, 47% choosing a virtual option. So it's close to 50-50 already, which is interesting. It sort of falls in line to those initial surveys. We kept talking and communicating and doing surveys along the way because conditions were changing, and so we thought families' ideas or thoughts about it might be changing. We all want to open schools face-to-face 5 days a week. As educators, we know that is an incredibly or the most beneficial way, really, for our students and for our teachers to certainly deliver instruction. But we know we have to keep safety, health and safety of paramount, not only for our students, but also for our employees. That's something that I hear on a regular basis from them. The start date for schools, our board will be voting on a calendar that would move the start date from August 17th to September 8th. That would enable perhaps a little more time to see if infection rates would decrease, but also really to monitor the continue to monitor the situation and have as much information as we can. I want to thank you for the opportunity to talk with you today. And if you have any questions, I'd be glad to take them.
Dr. Rodriguez, thank you. Our first question this morning for you comes from Denise. And Denise is asking, will you be doing additional parent surveys in the coming weeks prior to September to gauge parent sentiment?
Yeah, in a sense, our registration form is another survey in that sense, because it does allow parents to weigh in on whether they want a virtual or whether they want a face-to-face option. But I am going to continue to stay engaged with our parents through this. I think it's important as conditions change, the way people feel change. So whether it's surveys or whether it's connecting through SICs groups, but I do plan to stay engaged with them.
All right, thank you. Next question is from Susanna, and Susanna is asking if face shields will be allowed to be worn without a mask. So wearing a face shield without a mask underneath.
Yeah, we're requesting masks, and we're schools are going to be building into their schedule breaks for opportunities to have kids separate outside and get a chance to remove that mask for a little bit and then put them back on. But we are working through that, because that is something, I don't have that answer for you at the moment. That could change. I believe in the plan it spoke about masks, but things change, Bill and Susanna, and that is something that we are working through. Especially the younger that kids are, we recognize some of the challenges there too. So that's a piece we're still working.
Thank you. And I'll mention to the listeners that we have posted the reopening link that you can go to the chat box and see that and get the school's reopening link. Also want to mention that in the chat box, you can continue to ask questions. We have lots coming in, and we'll ask the ones that we have time for today. The next question comes from Kayla, Dr. Rodriguez, and Kayla is asking, will students above a certain age be required to wear a mask all day? And if so, what is that age, if you know that yet?
Doc, I can take that question.
Go ahead, Dr. Bradley.
So one of the things that we've really tried to do in our plan is to really prioritize the safety and security of not only our students, but also our faculty and staff. And so what we've done is our plan does currently call for the wearing of masks, but we've also built in a tremendous amount of flexibility for us to revisit any policies that over time we recognize may in fact need to change. So right now our plan does call for everyone to wear masks if they're going to be in a building. Face shields are supplementary, But like I said, we do have significant flexibility built into our plan so that if we recognize that something isn't working, we can step back from that and make material alterations to that.
Thank you for jumping in there and with that answer. Have another question for Jody. And Jody's asking, for those organizations that support families when children are not in school, where can we get our questions answered to prepare for taking care of children with assisting with virtual learning? For example, will we need to provide tablets for children? When and how will instruction be delivered in specific times or at each child's pace?
Okay, so we provide devices. Last year, you know, was there for 3rd grade through 12th grade. This year, speaking with our technology team, they will have devices for kindergarten through 12th grade, and so they'll have those devices that'll be available to them. We will schedule. If we have to lean towards a virtual opening, we will schedule a pickup day so that students can come and get their devices. In terms of class instruction, we will follow. We will have students following their schedules, and teachers will have recommended practices on learning platforms or modules that would be available to them in order to facilitate the instruction and the learning. And so within that, there'll be some recommended best practices and guidance that we will have expectations for our teachers to follow and our administrators to review and supervise at schools to make sure that they are best practices within online instruction and format. Dr. Bradley, anything else to that?
I just add that, since the release of our plan last week, we have been receiving lots and lots of very specific questions about how things will look, whether it's in a face-to-face environment or in a virtual platform. One of the things that we really plan to do is to release virtual briefings specific to instructional technology and also some of the operational details of what back to school will actually look like. We plan to release those virtual briefings on our website sometime next week, and our expectation is that that will answer many of the questions that we've received to date and cover a lot of the specific instances that parents are raising, really good issues that they're raising as well.
Thank you. Another question comes from Lily this morning, and will the children's temperatures be taken before the parent drives off?
We do not have that as part of the plan. DHEC does not recommend that as part of the practice or the plan currently. So if that changes, then that would be something we would obviously look at. But at the moment, that's not a recommendation from DHEC. But we are asking our parents to screen their children essentially every day and every morning and say, if they have a temperature or if they have any symptoms or conditions that they would keep them home. And we're asking really essentially the same thing of staff as well. So,
thank you. And our last question this morning that we'll have time for is, what is the date of the school board meeting where they will be voting on the school start date?
That's going to be a special called meeting. It hasn't been set yet, but we're anticipating that it'll be next Tuesday.
All right. Thank you. And Dr. Rodriguez, I was thinking back, I think it was this time last summer, maybe a little earlier, you were feet on the ground working hard to pass a bond referendum. And it was a flat out sprint then. And I know you're in a flat out sprint again. And we appreciate you, Dr. Rodriguez, as well as Dr. Bradley joining us this morning.
Bill, thank you, and thank everyone on the call as well. We appreciate it. We'll stay in touch and stay engaged.
Okay. Thanks, Dr. Rodriguez. Have a great day.
You too.
We've covered small business, which is very, very important to our region, as well as education. And now we're going to talk just a little bit about tourism, which is another pillar of economic vitality for the region. We're pleased to welcome back the Director of South Carolina Parks, Recreation, and Tourism, Dwayne Parrish. Dwayne?
Good morning, Bill.
Good morning.
I thought I'd give everyone a short update of sort of where we are, where we've been, where we are, and possibly where we're headed from now. So I'll start with the number of hotels closed. We're now down to 20 hotels closed in the state. We have identified 17 of those, which are long-term closures, such as renovations going on and the like, that are really unrelated to the virus. So essentially, we only have 3 hotels closed due to the virus. So we are pretty much open at this point. That's down from a high of 575 hotels back in mid-April. On the hotel occupancy side, I thought I'd give you a snapshot of June. I realize we're near the end of July, but we have numbers now for both hotels and for short-term rentals. On the hotel side, so the U.S. occupancy for the month of June was 46%. For the Southeast, it was 46%. And for South Carolina, it was 48%. Leading the way was Beaufort/Hilton Head. They categorize all of Beaufort County together. So Beaufort and Hilton Head had the highest occupancy for the month of June at 65%. So, excuse me, I'm sorry, I told you wrong, Bill. Those aren't the numbers I just gave you for the week ending July 11th. My apologies. I've gotten my numbers out of order here. But so for the week ending July 11th, that's Saturday before last. That week ending were the numbers I just gave you. So the U.S. ran 46%, the Southeast ran 46%, and South Carolina was at 48%. And again, Hilton Head had the highest occupancy at 65%. On a cautionary note and sort of reflection of what's going on now, that was the second consecutive week that we have dropped from a high of occupancy of 58% in South Carolina. We had 10 consecutive weeks of increasing occupancy from a low of 15% up to a high of 58%, as I mentioned. Certainly the recent national and regional publicity surrounding the number of cases, deaths from the coronavirus, as well as the positive testing rate, have caused us to have caused us to sort of, I talked about crawl, walk, run process. This is sort of taking a step back, if you will. Sometimes you take 2 steps forward, 1 step back. We've certainly taken a step back on tourism's comeback in the state. And I anticipate the following week, which will be the week ending July 18th, last week, will also be a slight drop in occupancy as well. Now, shifting back to June, on the hotel side, June's occupancy was 42% for the United States, 44% for the Southeast, and 52% for South Carolina. Obviously, we outperformed both the Southeast and the U.S. However, that's down from 2019 June occupancy of 72.3%, so down a full 20 points of occupancy. On the short-term rental market, we tracked this as well for the month of June. The U.S. was at 59%. The Southeast is 69%, and South Carolina also at 69%. Once again, the highest occupancy there was Beaufort County, which includes Beaufort and Hilton Head, at 75%. Going into the virus, short-term rental market was doing very well, and sort of catching up on hotels. It certainly has fared much better than hotels have during the virus. And 69% was the same occupancy in 2019 for the month of June for short-term rentals. So really is having, and that's with some additional inventory in there as well. Short-term rental market still continues to do well. I think the presence of a kitchen, more square footage, the ability to sort of, if need be, stay in your place longer has made that more attractive. So I thought I would share some of those numbers with you. Along the same lines, I thought I'd read the latest consumer sentiment about traveling from Longwoods International. So clearly the mask issue is having an impact on travelers' decisions. 60% prefer destinations which require a face mask in public, with 35% reporting they will only visit destinations with mandatory face mask orders. In contrast, only 9% of American travelers are less likely to visit a destination which requires face masks, with only 3% refusing to visit destinations which require face masks. Certainly, as I mentioned a moment ago, the ongoing official and media reports of spikes and surges of new cases in a majority of states, combined with several states and popular summer vacation destinations either pressing pause on or rolling back some of their reopening phases, continues to have an impact on traveler sentiment. by reversing many of the positive trends we had seen along the key indicators over the past couple of months. That goes back to what I talked about. We had a 10-week climb in occupancy, and then it had gone back down the last 2 weeks. 77% of travelers now report changing plans. That's up from 69% just 1 month ago. The percentage of American travelers who now feel safe traveling outside of their community has fallen once again to 38%, also a low since mid-May. On the positive side, concern about the economy greatly impacting travel plans is still low at around 20%. Along those lines, also, we're still advertising in our 350-mile drive market with our "We're ready when you're ready" tagline, if you will. Certainly seems to be working. We have, as I mentioned before, we've outperformed during those 10 weeks, and although occupancy has dropped, we are still capturing a little more fair share of the south of our market than the Southeast or the U.S. And then lastly, I thought I'd just share state parks continue to be extremely busy. We had a record month in May. We reopened May 1st. The month of May was a record year for parks in both visitation and in dollars of revenue. In June, we surpassed May in both of those numbers. July, I anticipate being very close to June, if not the same. State parks have remained very busy. If you've read some national reports about RV sales being up, that's indicative of what some people's traveler habits are changing somewhat. Certainly, parks offer a lot of square footage, a lot of acreage or space, if you will. That certainly seems to be attractive today. Our state park staff we have been in mass since May 1st on reopening date. As of last week, we now require our visitors that are coming to an indoor facility. That could be an office, could be a retail center, could be an interpretive center. We require them to be masked as well when they come inside. We also, Hunting Island, obviously of note, located in Beaufort County of note, had a flooding issue a couple of weeks ago with the heavy rains. It has not drained very well. We have added additional pumps this week, and we have had the day use areas closed. We hope to get that reopened by this weekend, so the day use area will be open. The campground is still open as of today, as well as some of the other areas down the interpretive center and so forth. But the day use area has been closed due to flooding, which should reopen by the end of this week. Pending any questions, Bill, that concludes my report.
Dwayne, thank you. And as you were mentioning occupancy, looking at our week of the 5th through the 11th, our hotel occupancy was right at 70%, 70.1%. And then just as the trend that you're seeing a little bit down, our projections for this week, the 24th through the 30th, we're looking at about 68.84, 69% occupancy for the week, and that's compared to last year of about 84%. So we're trending right in there, and we appreciate that. I want you also to know that Hilton Head Island and Bluffton, our residents and visitors are certainly taking the masking up very seriously, and we're pleased with what we're seeing with that. Dwayne, thanks for being with us today, and it's always good to hear your voice, and we appreciate your support as always.
Thank you, Bill.
Hi, all. I have Senator Graham, if now works for everyone.
This is a great time, and that was perfect. And we're fortunate this morning to have with us the United States Senator.
One second,
Graham.
let me connect him. 1 second, let me connect him.
Okay. All right. Thank you. Stand by for Senator Graham. While we're waiting for the senator, also want to mention that we're certainly wishing Mayor McCann a very speedy recovery. For those of you who might not know, he took a fall carrying some boxes in his home. And
Senator Graham is connected.
Great. Senator Graham, this is Bill Miles. It's since last time we've talked, you've had a birthday, and there's been lots of things going on in our country. We're glad to have you on this morning.
Thank you for Medicare. Appreciate it.
Tell us what you're seeing as you got back to Washington, and then with the $1 trillion plan that's being discussed, and kind of what you see going forward for business. I also want to mention, Senator, we had Tom Sullivan with the U.S. Chamber on with us this morning talking about small business things, and he's still on with us because he wanted to hear your update. So thanks for joining us.
I'm glad to, Tom. Thanks for being on. So here's sort of the friction points. Democrats want $900 billion for state and local government. We're not going to do that. They haven't spent the money we gave them last time. but we're going to have to do something on state and local government in terms of costs for the coronavirus. I know half our conference doesn't want to do it, but that's just what you got to do. We got to fix the unemployment benefit, the $600. We got to bring it down to $300 or $400 to make it so that people can go back to work. You're paying people $47,000 a year in unemployment benefits in South Carolina. That's what it comes out to, 600 plus 9, 324. That's just unsustainable. So we're going to have to lower that federal payment so people can actually get their employees to go back to work when they begin to open. I think you'll see some targeted relief for the PPP program, the second round. It won't be economy-wide, but like restaurants and bars and hotels, people really can't go out and eat. You can't travel like you used to. So I'm hoping there'll be a second round of some PPP relief. Money for our hospitals are beginning to overflow. Probably a direct payment of around $1,200 for people who make 40, 50, 60,000 bucks. That'll get some cash into the economy. I want to do a broadband component. Right now in rural America, you might as well be on the moon when it comes to the internet and cell phone service. So for $20 billion, we can finish the last mile of high-speed internet access for rural America. I want to do that. Got a provision I think is going to be accepted where we give tax credits to make the protective equipment for our nurses and hospitals in America, enticing the supply chain to leave China and come back here. Payroll tax cut, don't know if we'll make it or not. We're going to try, but we'll try to give some tax relief to employers who are trying to rehire people. That's sort of the structure. I think it's going to come out closer to $2 trillion than $1. Certainly not $3. Probably $1.5 trillion to $2 would be the outer limits of it, and it's going to be focused on reopening schools. $100 billion in our plan to do that. May wind up adding a little bit more. It's going to be focusing on PPE, making sure hospitals don't run out on the business side. Probably a second round of PPP loans, more targeted to the economy, and hopefully some stimulus checks for individual consumers, and do a little bit on infrastructure with broadband and a few other things.
That's a good start, Senator. Thank you. Question here for you this morning from Hannah, and Hannah's asking if the FMLA will continue to cover those working moms and dads who may need to facilitate staying home with their kids for virtual learning.
Yeah, well, that's certainly in the mix for sure. Because what do you hear about going back to school down there?
We had Dr. Rodriguez, our Beaufort County School Superintendent, on right before you, and he was talking about that and looking at the September 8th date, as well as, again, the opportunity for in-class as well as virtual learning, and those plans are still coming together with a lot of input from parents, as you would hope and expect.
Yeah, I hope and get school going, because transmissions from children is pretty low, and
right.
we got to get the economy moving. I mean, Memorial Day weekend was bad for South Carolina. You just see a big spike in June, and I think people sort of kind of got too aggressive going back. If people wear a mask, it will make a big difference.
Senator, we're I think our Hilton Head Island residents and visitors, as well as Bluffton residents and visitors, are certainly taking it seriously and doing just that. Got a question for you. This a little off the beaten track here, but Tom is asking what your thoughts are about the college football season.
It's funny, we're having a hearing today in the Judiciary Committee about images and licensing for football players. Let me tell you, this has gotten to be different. Several states have passed laws where players can get reimbursed for their jerseys that are sold. Car dealers can pay them to advertise for cars. You can't have a bidding war for college recruits. You're going to ruin college football. And every other sport depends on college football making money, particularly a lot of the like golf for men and women, those kind of things. But in terms of playing, I talked to the SEC yesterday. I think they're going to go to a conference-only schedule. We'll probably start without fans and see where it goes from there. But everybody in the country is waiting to see what the Southeastern Conference does. And they're meeting today, I think. So I would say 70% we play football without fans.
70-30. All right. Thank you for that.
Yeah.
On a personal note here on the 501c6s, Senator, it's if on the PPP, if I know you've worked hard on trying to get 501c6s included in that, and just keep that on the top of your radar, if you would.
Tim and I we're talking to Mitch, and I talked to the president last night. I mean, we got to have as much reach as possible. I think a second round of PPP is just not going to be system wide. When you look at PPP, you need to look at the industries that are just going to be having a hard time getting back into the game, and their bars and restaurants, service industries, golf courses, that kind of stuff.
All right. Thank you. And Senator, what can our listeners do to help you? You're busy every day working to try and help not only your constituents but all those across the country. What can we do to help you?
Just stay in touch and give me feedback as to what's working and what's not. The PPP program, generally speaking, Bill, don't you think it worked pretty well?
It did. We've heard from our members. We've heard from other colleagues around the country that it's been very successful and very helpful. That's important.
And just let the public know, maybe through an op-ed piece or something, that the unemployment benefits are just hurting the economic recovery. We want to be generous to people who are unemployed, but you can't pay them more not to work than to work. And that's going to be a big fight in this bill, and I'm going to get hit. But, you're paying people $23 an hour unemployment in South Carolina. That's just going to make it hard for a lot of your hotels and restaurants and other things in the service area to get their employees back. So, from a chamber's point of view, if you can just echo how we've skewed the wage scale it's going to delay the economic recovery. Just advocate for wearing masks. The more your businesses can require a mask, the better, because once people get used to putting a mask on to go inside a business, so it becomes more natural for them.
Yeah. Last question for you. A question regarding COVID and with your discussions with the president. Kelly's asking where you feel he is regarding the COVID issue.
Well, we talked last night. I thought his briefing was good. Yesterday it was focused. It was short. The death rate has come down fairly dramatically, but the infection rate is rising. You worry about hospitals being overrun, so we're going to try to stay ahead of that. The PPE equipment is holding steady. Testing, where it takes too long to get results back, so we've got to expand testing to go back to school. The president, I played golf with him Saturday and Sunday and had dinner with him Monday night, spent a lot of time with him. The president realizes that the virus is his probably biggest opponent. He had 85 days of pretty much disengaged. I think you're going to see him more engaged, more talking with people, more cabinet level meetings about the coronavirus, more news conferences, more hands-on leadership. The really good news is that there are a couple of vaccines that are exceeding expectations. So by as early as September, we could have some vaccines that have gone through the trial phases and begin, later in the year, start getting some vaccines out to the public. That's the only way you're really going to get back to normal, is to get a vaccine that works, and large scale distributions probably early next year. But I think the day that people believe the vaccine works and it's going to be available is good for the president. I think he'll have some windows back if we pass a stimulus package. I'd like a payroll tax cut. I don't know if we can get it or not, but I'm increasingly hopeful that October will be good news on economic recovery, and by October we'll be in a much better position when it comes to therapies and vaccines. And told the president this is his number one challenge right now. Law and order is a problem. You can't run an economy when people are rioting in the streets. Thank God that hasn't come to South Carolina. So tough times, but we're back at it, and appreciate your support and what the chamber's done for me. And best thing you can do for me is pray and just give me feedback on what's working and what's not.
We'll do it. How'd you play before we let you go? How'd you play Saturday and Sunday?
I sucked Saturday, better Sunday. He played like 74, 75 both days. It's amazing. He's 74 years old, whatever. He is a good golfer. And I told him, I said, listen, me and you are not going to open up an exercise gym. I need to do a lot more, so to see. But his time on the golf course is his way of getting away from the job. And I know he can be a handful, and he probably goes further than he should a lot, but he really is taking his job seriously. He's a lot of fun to be with. And when it comes to South Carolina, I think we've got a lot of access to this president, and just hang in there. And I'm hoping that by October we're in a much better shape on the virus and the economy.
Senator, thanks for joining us. You're kind to do so. We wish you the best, and we'll be in touch. Thank you again for being with us this morning.
I'll come down and see you soon. Thanks, guys.
We're ready for you. Have a great day, Senator. All right. Our last speaker we're going to have this morning to close us out, to give us an update from DHEC, is Dr. Michael Cack. And Dr. Katka, thanks for staying on with us and being back with us again this morning.
No problem. I appreciate the opportunity to speak. So as of yesterday, in the past week for the state of South Carolina, we're reporting 12,787 confirmed and 20 probable new cases of COVID-19. This brings the total number of people with the disease in South Carolina to 73,101 confirmed and 236 probable cases. For Beaufort County in the past week, this includes 487 new confirmed cases and 0 probable cases in the past week, for a total of 2,580 confirmed and 4 probable cases. Now, you may have noted before that I reported 5 probable cases, and I'm now reporting 4. I'll actually provide an explanation for that at the end. So for the Hilton Head zip codes 29926 and 29928, 59 new cases were reported for a total of 485 cases. For the Bluffton zip codes 29909 and 29910, 124 new cases were reported for a total of 812 cases. So the 487 new cases reported in Beaufort County is similar to the 478 new cases reported in the week prior. For Hilton Head, the 59 new cases in the past week is similar to the 54 reported in the week prior. And for Bluffton, the 124 new cases is down a little bit from the 157 reported in the previous week. Unfortunately, today we're also reporting 217 additional confirmed COVID-19 related deaths and 20 probable deaths in the state in the past week. This brings the total number of people confirmed to have passed away from the virus to 1,203. There's also been a total of 18 probable deaths related to COVID-19. 6 additional deaths were reported in Beaufort County individuals, and the total there is at 28. 1 probable death has been reported in Beaufort County. So a little bit of good news, bad news. Some of the good news is we are seeing some indication that the case numbers may be leveling off in the past 2 weeks, but it's still too early to confirm that there is a trend there. And of course, our case numbers still remain very high. Testing in the state has exceeded the July goal of 140,000 tests as of July 16th, so only a little bit halfway through the month and already exceeded the testing goal. However, the percent of those tests coming back positive has ranged from 17% to 22%, which is well above our benchmark of 5 to 10% that we want to hit. So in addition to increasing testing as we've been doing, it's also important that everyone do their part to bring these case numbers down in order to get those in the appropriate reporting area. Unfortunately, we've also seen an increase in COVID-19 related deaths, which is expected because deaths do tend to lag behind increases in case numbers. And only by preventing new cases can we bring the number of deaths back down again. So I will wrap up by explaining the difference I noted in the probable cases for Beaufort County. So when we report data, we actually report it based on the person's actual residence. So we don't always know that immediately until we actually do an investigation. And normally we wouldn't release data until that investigation's been done. But because of the unique situation we're seeing with COVID-19, we're reporting more real-time data. So we're reporting cases each day based on the information provided when the lab is ordered, which may not always include the person's correct address. So we revise the numbers based on our findings from the investigation. So this is why sometimes the numbers may seem to fluctuate or may not match up from day to day. I thought it was important to explain how those numbers come about because although this is normal operation for us, it has created some confusion in the public. So of course, you know, I need to wrap up by reminding everyone to wash their hands frequently, practice 6 feet of distancing from others when out in public, and of course, masking up when out in public as well. And for any other updates on COVID-19, you can visit our website, scdhec.gov/COVID-19, and I'm happy to take any questions.
Thank you, Dr. Katka. First question comes from Steve, and Steve is asking how DHEC defines new cases, last 2 to 3 weeks or last week, just how they define new cases.
Well, new cases are any new individuals reported to us with a positive lab. So confirmed lab means that they had the swab test of their nose or mouth, and that swab test actually determines or actually detects the actual virus. One of the questions that's come up about this is some people do get repeat tests and get repeat positive results back. Those are not reported as new cases. We do have a system for deduplicating all the reports that come in. So when we get an additional positive result on a person, it's not counted as a new case. So that's what our new cases are, any unique individual with a new positive lab.
Thank you, Doctor. Next question comes from Kayla. And Kayla is asking that what is the estimated length of time it takes to get results from a public testing site?
So that's very greatly depending on the lab. So our public health lab has been able to kind of keep up with demand. It's even with the test numbers that we're seeing right now, even they've gotten a little backed up at times. They're tending to turn around in 24 to 48 hours. Some other commercial laboratories have been more backed up, and we've been hearing that it's been taking several days to get back the results. So it could depend a lot on the individual lab and what their capacity is to run the test.
Okay, thank you for that. And then a follow-up question would be, if people test negative, do they get a report back, or only the ones are testing positive get notified?
Everyone should get a report back of what their result was.
Okay, very good. Dr. Katka, thank you again for being with us. Thank you for that update. I want to thank all of our listeners this morning for joining us. And as it's summertime in the South, I want to remind everyone as temperatures continue to rise, sometimes tempers rise as well. And our Be Kind campaign is something that we hope everyone will take into serious consideration and be kind to each other. Thanks for joining us. Look forward to being back with you again next week. Have a great rest of your day. Bye-bye.